One of the things that were really important, I think we've only scratched the surface on, is nutrition and its impact on athletes' just regular performance, but also recovery and healing and things of that nature. So it's my pleasure to introduce our next speaker, Marisa Faibish. She is the lead dietitian for our sports health program, working out of the Sports Health Performance and Wellness Center. She also works with the Bellarmine Knights and numerous other teams and organizations and affiliations that we have. She's a registered dietitian as well as a board-certified specialist in sports dietetics. I can tell you that I believe in what she does. I've taken my own kids to her, and it's really impactful, and I'd really highly recommend utilizing this resource for your athletes as well. So without further ado, we're going to talk on nutrition recommendations following injury and surgery.
Good morning, everyone. Pretending like I know how to use this. How's everyone doing? Feeling good so far? Thank you all for being here. Again, I'm Marisa, and we'll be talking about nutrition recommendations following injury and surgery. Okay, I can use this. At this point in time, I don't have anything to disclose in regards to this presentation. And just like every other presentation, here's a brief overview. So today we're going to be talking about concerns surrounding injury, followed by goals of the recovery process, metabolic response due to muscle disuse and immobilization. Then we'll get into the nutrition recommendations and then research-based supplements that may help. Now I'm going to ask you guys a question, so please answer. But what are some concerns that you have surrounding your athlete after an injury? And you can just raise your hand, but I need some interaction here. Yes? Perfect, okay. I don't know if you guys can see my presentation. Oh, there it is. Any other? Return to sport. Okay. Access to food and different things. Anything else you can think of? Re-injury, absolutely. Okay, so it sounds like we have a bunch of different concerns, but here are a couple of other things that we may have not realized that also obviously attribute to some concerns. The loss of function within the athlete, obviously loss of overall muscle mass, loss of strength, loss of range of motion, mental performance and mental health, like we just heard, the overall quality of life of the athlete, and then body composition changes. Right? Those are all probably things that we probably didn't think about, but definitely are concerns that we have when an athlete is either immobilized, injured, surgery, whatever it may be. Now, I have another question for you. What is the goal during the recovery and rehab process that you have for your athlete after an injury? She just asked another question. We all have goals, right? What are they?
Return to sport better than before.
Return to sport better than before. I love it. What else? Oh, come on. We got some goals, right? Yeah? There it is. Yeah, regain range of motion. So again, we all collectively have our goals, but to reiterate, attenuate muscle atrophy, so preventing that decrease in muscle during this time, obtaining strength and function within the athlete, regaining range of motion, maintaining body composition, return to baseline neurocognitive ability, so especially if our athletes suffer from a concussion or a TBI, we want to make sure that neurocognitively they're coming back to normal. And then the most important thing is return to sport, so getting back to those sport-specific skills that the athlete has. So now that we talked about all of your goals that we have with athletes and injury, what are some nutrition goals? Now, as a sports dietitian, my goal is to help you all and support you during your process to helping this athlete get back to their return to play. So here are some things that I can help you all with. Supporting muscle protein synthesis, or MPS, so essentially keeping this athlete in an anabolic state, so a constant regrowing and repairing of the muscles. Maintaining energy balance, so making sure this athlete is having optimal calorie intake to help the wound healing process. Preserving muscle mass, of course, we want this athlete to preserve as much muscle as they can during the recovery and rehab process, so when they come back to their field of play, they're not 15 steps behind, but maybe only 5 steps behind their athletes. And then lastly, going with that, preventing body fat accrual. So just making sure they have optimal body composition during this entire process. Now, before we dive into nutrition recommendations, I want to go into the metabolic response from decreased activity, immobilization, and muscle disuse. So injury requiring even limited immobilization or muscle disuse may have detrimental metabolic and functional consequences within the athlete. And as little as 48 hours after the injury or muscle immobilization, we can see altered gene expression within the athlete, whether that's a upregulation oxidative stress pathways and also a decrease in insulin sensitivity in the mitochondria. The next is as little as 5 days after that injury or muscle disuse, we can see anything from decrease in muscle function and overall muscle size. But I think the biggest thing I want to note on this slide is the decrease in MPS, because that'll put that athlete in a net negative muscle protein balance, which will attribute to that muscle atrophy. And then with that, we are more likely to have something called anabolic resistance, which is the inability to be in that anabolic state because of that decrease in muscle protein synthesis. So we know, obviously, with all of that, nutrition can play a key role in helping that, and the intervention should start during the beginning of from injury all the way to recovery, injury, surgery, and all that entire process, whether it's going to be helping the stimulation of MPS and helping that resistance in the anabolic resistance. So here's a really great figure that goes over muscle protein synthesis and where the athlete is and where we want them to be. So you can see in the red box, muscle protein synthesis is going to be less than muscle protein breakdown, which is essentially going to put the athlete in a catabolic response, so a constant breaking down state, right? Our goal, especially I'm sure all of you as well, but with dietitians and with nutrition, our goal is to maintain this muscle mass during this time, and also eventually when we get to that rehab process, gain that muscle back, so get back in that anabolic state. So you can see here MPS is the major metabolic mechanism behind that negative net muscle protein balance as well as that atrophy within the muscles. So let's get into the fun stuff, nutrition recommendations. And I think it's funny because I'm sure you're probably expecting this crazy answer of what can I do to help this athlete get back when it's really simple. And I think that's the best thing, is that it is simple and that you guys can also say the same things that I'm saying to help this athlete during this time. So first is going to be energy balance. Of course, we know if an athlete's injured, they're decreasing activity, they're immobilized, they're post-surgery, whatever it may be, their energy expenditure is going to be decreased. However, I do want to note that it's not as decreased as we think it is. Because an athlete, for example, that's on crutches can actually burn up to 2 to 3 more times calories than an athlete that's just walking. So I think the biggest thing to note is that you need to find that balance and that energy balance within the athlete, and it's ever changing and ever fluid throughout this, obviously, the injury and recovery process. Too little calories will actually decrease the wound healing and increase muscle atrophy, and too many calories during this time can increase overall systemic inflammation, which of course will also affect that wound healing process. So during this time, of course, as a dietitian, if they're involved in the process, you want them to create a maintenance plan. So starting from injury to the most immobilized and obviously decreased activity as possible, to that surgery, to all the way to that rehab when they're picking up their calories, right? So making sure they're having that maintenance plan. So calories in versus calories out, we want that athlete to always be in the maintenance and ever changing throughout this process. The next thing is my favorite, protein. We all love high protein diets. So protein is going to be crucial for that wound healing process as well as that preservation of lean muscle mass and making sure that we're increasing that stimulus of MPS, that muscle protein synthesis. So a high protein diet during injury and recovery is going to put that athlete in the best position to maintain as much lean body mass as they can. And there was a great study by Mettler et al. That had 2 groups of athletes, one in a high protein group at 2.3 grams per kilogram, and one group in a low protein group at 1.0 grams per kilogram. And the study showed that the athletes that had the higher protein diet were able to preserve way more lean muscle mass than the athletes with the low protein diet. Again, just showing how important protein can play a key role in the athlete maintaining their muscle, regrowing, repairing those issues from the surgery or the injury that they had. Another thing I want to make sure we note is that muscle protein synthesis is maximized in 20 to 30 grams of protein at each meal. I'm sure we've all heard about like the anabolic window after we worked out, and that their 20 to 30 grams is usually what you want to have to get the most you can get from protein synthesis. I'm sure we've all heard the bodybuilder.com say that or something like that maybe. But it's a real thing. But obviously we know during this time MPS is downregulated, so we want to make sure that we're increasing the amount of protein we have per meal to get that same stimulus from MPS, right? So I gave a good example here on the right. Well, overall, protein needs during injury, recovery process, surgery should be anywhere from 1.8 to 2.5 grams per kilogram a day of protein. And then when you break that down, for an example, with a 100-kilogram athlete, that's anywhere from 150 to 250 grams of protein that that athlete should have that day. And then when you break it down into per meal, which is a little bit more digestible, no pun intended, it's roughly 35 to 40 grams per meal that this athlete would need to have during that time. So let's talk about some foods that have some key components in them that may actually help the process of the recovery. First is one of my favorite. I'm sure we've all heard of it. It's tart cherry juice. Now, this can come in many different forms. I've used, when I was at Florida State, we used concentrate that we put with Powerade to get electrolytes as well for the athletes. But the biggest thing with tart cherry juice is that it has an extreme high dose of antioxidants. So it's extremely good for anti-inflammatory properties. But my favorite thing about tart cherry juice is that it has natural melatonin in it. So we already know athletes, when they're injured or post-surgery, their sleep is completely disrupted. They do not have good sleep. I'm sure if any of us have been injured before, we don't have a great sleep, right? So tart cherry juice may be a great thing to add into their diet to help not only with inflammation, but also their sleep and overall recovery. Next is going to be omega-3 fatty acids. I'm sure we've all heard of that, but that's going to be found in your walnuts, your flax seeds, olive oil, avocado, salmon, tuna, all those fatty fish. And that's going to be also anti-inflammatory. It has great neuroprotective agents in it, so it's great for athletes that have concussions or any sort of TBIs, but it also is overall great for muscle recovery and inflammation. Next is going to be casein, and that's going to be found in our dairy products, high-protein dairy products like cottage cheese or Greek yogurt, and that's going to help your stimulus of MPS and preserve that lean body mass during this time. And then gelatin-based foods, so that's going to be like your Jellos, for example. They have been shown to help with supporting collagen synthesis within the athletes. So if we have an athlete with maybe a ligament tear or any sort of soft tissue injury, this could be a great thing to add into their diet as well, and it's pretty cheap too. And then last is going to be branched-chain amino acids, and those are going to be found in any of our high-protein animal proteins, dairy, anything like that. And that, of course, is also going to increase, like we said, stimulating MPS, preserving lean muscle mass as well. But I do want to note that leucine is going to be the biggest one that we want to make sure that we're getting in the BCAAs, and we want roughly 3 grams of leucine every 3 to 4 hours. And you can find that in a piece of a 3-ounce or 4-ounce chicken breast, for example. So now we talked about the food. Let's get into the fun stuff, right? The research-based supplements that may pose a benefit towards recovery. Now, this obviously is not a supplement. This is a pizza roll. But does anyone know why I put this on this slide? Does anyone know why I put a pizza roll on this slide before we got into supplements? Someone's got to answer. And not because it tastes good. Anybody? Yeah?
Because it's a typical college meal.
Oh, we got a microphone.
Because it's a typical college meal of a college athlete.
Okay, you're right, definitely. I definitely deal with kids that have that. Any other explanations? I heard someone maybe say something over here. Lycopene? Oh, yeah, that's a good idea too. Nope, that's not the answer. All right, so I'll tell you guys, and I will die on this hill, I promise, but you cannot out-supplement a pizza roll diet. That's how I'm going to say it. If your nutrition and your fueling plan is not sound, if we're not eating properly or fueling properly, supplementation is not going to change that. It's not going to help you. So as a medical professional, athletic trainer, doctors, whoever we are here, make sure this athlete gets their nutrition right, is fueling properly, eating enough calories before they get into supplementation. So I think a lot of us see a pyramid and we think the first point of attack is, let's just throw them all these supplements and get kickback from it, right? Not that we all do that, but there's some people that do that. But really, the main thing we want to focus on is that energy intake and balance, followed by that protein, then those micronutrients, and then supplements. That's the last thing. And I just want to make sure we all understand that I would rather us focus on the athlete's basic foundations, healthy habits, making sure they're eating enough calories to even sustain the stimulation of muscle protein synthesis before getting into that supplementation. So let's talk about the fun stuff now. Creatine. I'm sure we have all heard this before. It is one of the most widely researched supplements in the entire world and is already known for muscle recovery, increasing power output, increasing strength, helping muscle repair, and also has neuroprotective agents in it as well to help with concussions and TBIs as well. So we already know that that's happening with athletes that aren't injured, so why not use that positive outcome from creatine for athletes that are injured, right? So doses are going to be anywhere between 5 to 20 grams a day, and that's going to be dependent on the athlete because sometimes creatine can have a little bit of a GI discomfort or upsetness from it. And I will note that this has to be taken through supplementation because in order for us to even get 5 grams of creatine, we would all have to eat a pound of raw meat a day. And is anybody here doing that? There's the carnivore diet, so maybe some of us are. None of us are eating a pound of raw meat a day, right? So definitely supplementation is needed for creatine. When I was at Florida State, that was something that we definitely recommended and prescribed to our athletes immediately after concussions. So that was something that we always wanted to ensure that we were doing. Next is going to be protein and essential amino acids. Now, of course, I noted here that this can be achieved through diet. This does not need to be a supplement. But what happens when an athlete's injured? Their appetite is completely suppressed. They have no appetite. They're maybe sad. They're maybe in bed all day. They don't want to eat. So supplementation with these two things can be beneficial to help them get at least some sort of protein in their diet. And we already know protein is going to help, like I said, that stimulation of muscle protein synthesis, preserving that lean body mass, and helping that wound healing. And again, to reiterate, 3 grams of leucine that can be found in supplementation as well in powder or pill form every 3 to 4 hours. And then protein is going to be 1.8 to 2.5. And we've all seen whey protein powder before and things of that nature. Next is going to be HMB. So this is going to be a leucine metabolite, okay? So it's very similar to leucine in helping the stimulation of muscle protein synthesis, but it will also help prevent muscle protein breakdown. So very similar to leucine, a very easy supplement that you can get that's very cheap for pills or powder, and that's roughly 3 grams a day is the optimal amount that you want during that time. And then the last supplement that we'll talk about is going to be omega-3 fatty acids. Now, this is one that none of us here eat enough omega-3s in our diet. Unless we're eating salmon, avocado, walnuts, and flax seeds every single day, not any of us in this room eat enough to get the benefits from the dosage that we need. So this is one supplement that I usually off the bat pretty much tell everyone they need to get on because we do not get enough in our diet. It's really, really hard and really expensive. So for omega-3s, we already know them as anti-inflammatory, helping with muscle recovery, and specifically from fish oil, both EPA and DHA. DHA is going to be the one that's going to help with the concussion and TBI, so making sure we get enough of that. But the goal and the dosage is going to be anywhere between 2 to 6 grams of fish oil a day, and that's going to depend on the severity of the injury as well as the TBI or concussion. So one thing I want to note is a lot of athletes, when they get injured, immediately stop eating a high-protein diet and immediately stop taking their creatine, either on fear of they're going to gain weight because they're not doing as much, or because they're not working out as hard. They don't think they need their protein or creatine anymore, which we just learned that both of those are extremely important in helping doing quite the opposite. So if we do have an athlete that comes to us that is injured and they immediately stop having their high-protein or creatine diet, please let them know to continue doing that because that is going to help them with the preservation of lean muscle mass, as well as helping them with the wound healing, as well as all of those good things that we require for that recovery process. So I just said a lot of crazy things to you about nutrition, what we need to do, what supplements we need to take. Now, how does that look like in the real world, right? How does that look like on a plate for an athlete? How does that look like for anything that they can actually do? And here's a really good example, especially for, again, an athlete after an injury. I know me after an injury, I don't want to eat, but most of them have a pretty down-regulated appetite. So this may be a really good way to get in those calories that they need, as well as all of those good things that they would need as far as HMB, creatine, fish oil, and all of that good stuff. So an example can be a 10-ounce fat-free milk, 35 grams of whey protein, 10 grams of creatine, 3 grams of HMB, 4 grams of fish oil, and then we add it off with some 30 grams of tart cherry juice or frozen mixed berries to increase those antioxidants. So again, just showing you, I know you can say a bunch of information, but I think it's better for you to understand how to actually implement it to the athlete. If I'm not there, if you don't have a sports dietitian on hand, having these tools in your toolbox to help the athlete and guide them to understanding this stuff is really, really important. So going with that, some key takeaways that I want you all, if you didn't remember anything I talked about today, please just remember this slide. But the biggest thing is going to be energy balance is key. If this athlete is not having optimal calorie intake from hour zero to all the way to return to play, and making sure that energy intake is fluid throughout the entire process to help that wound healing. Next is going to be a high protein intake, and it's crucial, again, like I said, for the preserving of lean body mass and muscle protein synthesis. Next is going to be supplements are not necessary. However, if the athlete has a sound diet and their nutrition is on point, then supplementation is only beneficial for them. And then, of course, athletes that are on a high protein diet and are taking in creatine prior to injury, please let them know to continue doing that to help them. And then lastly, of course, if you have the capability or resources to reach out to a dietitian to help you so you don't have to take this on, please don't hesitate to reach out to a sports dietitian and look into finding one of those, because we're here to help you and support you in your process. And that's all I got. Thank you.